Good day, viewers. Welcome to DDM House News Update today on our usual program. Your health is your wealth. Well, today we focus on a critical issue that affects public health, sanitation, and the overall well-being of our nation. That is open defecation. Wow. In 2019, former President Muhammadu Buhari signed Executive Order 009 to eliminate open defecation by 2025. However, 6 years later, the figures tell a different story. While the target year has come and gone, millions of Nigerians still lack access to proper sanitation facilities. Who knows what the problem could be? Well, the Tinubu administration has now shifted the deadline to 2030. But can this new goal be achieved? Let's take a deep dive into the realities on the ground. At the time of signing the executive order, statistics revealed that 47 million Nigerians were engaged in open defecation. Hey! Now so they go shit tire for road. Fast forward to 2026 and the number has only reduced marginally to 46 million. This slow progress has raised concerns about the feasibility of achieving an open defecation-free Nigeria in just 4 years. Oh my God. However, some key developments may provide a fresh opportunity to address this sanitation crisis. May shit no go finish us for road. One major breakup is the financial and autonomy granted in Nigerian 774 local government areas. This came after the Supreme Court's landmark judgment in July 11, 2024. With control over their own funds, local governments now have the potential to revamp water governance and invest in sanitation infrastructure. The provision of public toilets, maintenance of water supply, and effective waste management can now be pursued more aggressively at the grassroots levels. This is a very, very nice move. Another crucial factor is the revival of sanitary inspections. Back in the day, wole wole as they were called in Yoruba language, and wolala among the Igbos, even among the Hausa is Dubagari, were feared and respected enforcers of hygiene laws. These environmental health officers ensure that homes, markets, schools, and workplaces meet sanitation standards. However, financial constraints over the years have rendered them almost obsolete. With local governments now empowered, the recruitment and deployment of these officers could be revitalized, strengthening enforcement against open defecation. Meanwhile, experts insist that political will is the most critical factor. Calls have been made for President Bola Tinubu to declare a state of emergency in the water, sanitation, and hygiene sectors. The argument is simple. Without a significant financial commitment, the goal of eliminating open defecation by 2030 will remain a mere aspiration. Yes, because money is the key of everything. India's example is a compelling case study because India as a country once labeled the open defecation capital of the world, reversed its status through deliberate policy actions. Under Prime Minister Narendra Modi's Swachh Bharat mission, over 100 million toilets were constructed in 5 years, backed by a $20 billion budget. Can Nigeria replicate such success? The answer lies in the government anyway. Readiness to fund large-scale sanitation projects and mobilize human resources effectively. According to UNICEF, Nigeria requires approximately 20 million toilets to meet the 2030 targets. While progress has been made, only 135 local government areas have been declared open defecation free so far. To change this narrative, President Bola Tinubu must take decisive action. He has the resources, he also has the power. So, what remains is the will to make the history. Yes, that is the real thing to be done. Because as the clock ticks, the challenge remains. Will Nigeria rise to the occasion or will the goalposts continue to shift? Well, time will tell. Up next, the World Health Organization, that is the WHO, is staring at a massive financial crisis following the United States' decision to withdraw its funding, despite already making drastic budget cuts, a new report has revealed. According to Health Policy Watch, the United Nations Health Agency has been forced to slash its proposed 2-year budget for 2026 to 2027 from $5.3 billion to $4.2 billion. So sad. However, even with this significant reduction, the agency is still struggling with a $1.9 billion shortfall. This comes on top of an existing $600 million gap in WHO's 2024 budget, bringing the organization under intense financial pressure as it prepares for the US exit in January 2026. The United States, which has historically been WHO's largest donor, contributed $1.3 billion during the 2022 to 2023 budget cycle, with most of the funds coming from voluntary contributions for specific health programs rather than regular membership dues. However, Washington has refused to pay its 2024 dues and is expected to default on its 2025 obligations, leaving WHO short of $260 million in membership fees alone. The situation has left WHO's Director General, Dr. Tedros Ghebreyesus, with no option but to implement drastic cost-cutting measures, stating with senior leadership at the agency's headquarters. Dramatic cuts to official development assistance by the United States and other countries are causing massive disruptions to health programs worldwide, including WHO. Tedros reportedly told staff in an email obtained by AFP. He also warned that the financial crisis would lead to significant workforce reductions and reduced operational capacity, thereby affecting health initiatives across different regions. Last month, Tedros pleaded with the US government to reconsider its decision to withdraw from WHO and to cut global health funding. Wow, what a pity. He warned that the sudden halt in funding could have devastating consequences, particularly in the fight against diseases like HIV and AIDS. According to him, disruptions to global HIV programs alone could result in over 10 million new infections and 3 million HIV related deaths. Wow, what a huge amount of that. The development has raised concern among global health experts who fear that WHO's financial struggles could cripple its ability to respond to global health emergencies and sustain vital health interventions across developing countries. With the US pulling out, the big questions remain. Will other nations step up to fill the financial gap? Or will WHO be forced to scale down its critical work worldwide? Well, let's keep watching. Up next, the World Health Organization has sounded the alarm over maternal sepsis, describing it as the third leading cause of maternal mortality worldwide and a major contributor to overall sepsis related deaths. The global health body warned that maternal sepsis poses severe risks to pregnant women, leading to life threatening infections that can also affect newborn babies. It's noted that the condition, which occurs during pregnancy, childbirth, post abortion, or the postpartum period, results from the body's abnormal response to an infection, causing damage to organs and tissues. According to WHO statistics, about 800 women die daily due to pregnancy or childbirth related complications, most of which could have been prevented with proper medication intervention. Wow, so sad. Between 2003 and 2009, maternal sepsis was responsible for 11% of maternal deaths globally. Nigeria's alarming maternal mortality rate. Nigeria remains one of the worst hit countries, with a staggering maternal mortality ratio of 512 deaths per 100,000 live births. Data from the 2018 Nigeria Demographic and Health Survey, that is NDHS, indicates that postpartum hemorrhage accounts for 23% of these deaths, while maternal sepsis is responsible for 17%, and unsafe abortion contributes 11%. The Global Burden of Disease reports further revealed that in 2019 alone, an estimated of 21 million cases of maternal sepsis were recorded, leading to approximately 70,000 deaths globally. WHO's intervention to curb maternity sepsis in an effort to tackle this crisis. The WHO previously introduced the WHO recommendations for prevention and treatment of maternal peripartum infections. The guideline provides strategic directions for improving antenatal, intrapartum, and postnatal care, aiming to reduce maternal and neonatal infections. The WHO has also reaffirmed its commitment to enhancing clinical best practices during labor and childbirth. To this end, the agency is set to review recommendations on the use of antibiotic prophylaxis during vaginal birth. According to WHO, a guideline development group, that is GDG, meeting will be held on April 9 to 10, 2025 to assess scientific evidence regarding the possessed recommendation. In line with the requirements of the WHO Guidelines Review Committee and the WHO Compliance, Risk Management and Ethics Office, we are measuring transparency in the process. The organization stated this on its website. So, as part of this initiative, the WHO has published short biographies of GDG members and is inviting the public to review the experts involved and provide feedback on any potential conflict of interest. With Nigeria battling high maternal mortality rates, health experts have urged the government to intensify efforts in providing quality maternal health care, thereby ensuring that preventable causes of death, such as sepsis, are effectively addressed. Well, listeners, this will be all on your health, your wealth. Until next time, Don't forget to click on the like button, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, for more news updates. I remain your host, Nenya Michael Inezinde. Thanks for watching.